In 2021, after months of pain and no clear answers, I finally had an endoscopy. Now, I was really healthy, I was in my mid to late 20s, so I didn't really expect a lot to come from that. However, I was shocked when I was diagnosed with endometriosis. This is a condition where tissue, similar to the lining of the uterus, grows outside of the uterus. This can cause pain, inflammation, and in my case, even infertility. Wow, was I shocked. My provider gave me two options: have a partial hysterectomy or try to conceive, knowing the path might be long and difficult. That moment rocked my world. Suddenly, we weren't just making a healthcare decision, we were making a life decision. And oh my gosh, was it a big one. So that moment opened my eyes into a process in healthcare where I realized we can't just be part of the healthcare system, we have to be active in it. We have to be engaged patients in our journey, because that's really at its core what healthcare is. It's a conversation. So my husband and I tried for 2.5 years to conceive naturally. I read studies, I joined forums, Facebook groups, I researched, I learned so much about ovulation. I even researched myself. Now, this might sound obsessive. It's not. It was strategic. Because in a healthcare system as complex as ours, it is essential that you do your homework and that you are prepared to advocate for yourself. So when my husband and I decided to pursue IVF at Washington University in St. Louis, I didn't walk in blindly. I walked in informed as a patient who was ready to have conversations that would ultimately impact the rest of my life. Like the time, my sister-in-law and I drove 1.5 hours to St. Louis, just for some simple blood work as part of the initial IVF process. Because I had her there, because she encouraged me, I advocated to be able to have a procedure that allowed us to start IVF a month early. Or the times I asked for clarification on medications. If you didn't know, you can ask that. You can ask for more time. You can ask for a different timeline or a different approach. What I learned through that process is you don't know what you don't ask. So many times the answers are there for us. They're just waiting for us to have the courage to lean in and have the conversation. Or the time I asked my health system, Phelps Health, what benefits they offered for IVF, because it's astronomically expensive. It can be really unavailable for most people to utilize. What I found out, because I asked and advocated, I didn't wait for someone to come to me. My health system wound up paying for half of my IVF, making it that much more affordable and attainable to begin that process. So, our IVF was successful. We became pregnant with our son, which is so exciting. But what I learned through that experience didn't end with 2 pink lines. It followed me throughout my entire healthcare journey, from building my birth plan to choosing my providers, and even to how I made decisions during delivery. So I say this because in healthcare, and often in life in general, sometimes we're taught that you don't have options, that you just have to comply, that there's no collaboration. But here's the truth. You always have options. You can say no. Who would have thought? You can say no. You can ask for a different opinion or a different approach. You can ask to have a new medication. This was so important in my journey and in others as well, that we learn how to be passive or not. We learn how to be active participants in our care and not to be passive in those conversations. But what I went through was really part of a much bigger issue. According to advances in nursing science, benefits of effective self-advocacy include improved person-centered care and quality of life, and reduced symptom burden and use of preventative health services. Think about that. It's not the machines, it's not the medicine, it's the conversations, or lack of them, that can harm or help our care journey. So it is so important that we look at ourselves whenever it comes to care or anything in life and know that we are our best advocate, and it is so important that we use our voice to speak that. So, what can we do to empower ourselves as patients? There are a couple of things that I've used and still use today that I encourage you to try. The first one is keep your own medical records and data. The point of this, and this isn't just for healthcare, You are your best advocate in all aspects of your life. You know yourself, you know your body, you know what works best for you. Keep a running list with you. Open a notes tab. Make sure that you bring that to every appointment. That way you can have informed, empowered, engaged conversations whenever it comes to your healthcare. The second one is ask questions. This is a big one because you have to lean in and have the courage to say, I may not know the answer and it might sound kind of funny whenever I ask this, but what does this mean for me? The third one is look at your insurance and benefits. It can be very overwhelming to look at insurance and benefits knowing that they're pages long. However, take the time, find a resource, find somebody in HR that can help you understand that process and what's available to you, because that's also going to tell you what else you need to seek out in order to get the care that you need. And the last one, arguably one of the most important, is bring someone with you to appointments. Having a second set of ears, especially whenever you are making some of the most important healthcare and life decisions that you could make, it's really nice to have a second set of ears that can write down questions, can ask things that maybe you didn't think about, and can jot down the notes so that you can really be engaged in the conversation you're having. So, all this to be said, I'm not a doctor, I don't have a medical degree, but I do know this. Healthcare works best when we stop showing up as passive recipients and show up as empowered patients in our care. And empowerment, that doesn't come from knowing all of the answers. It comes from having the courage to lean in and start the conversations. That's how we change care, that's how we change outcomes, and it starts with you. Thank you.